All right, a very good evening to everyone. Hello, my hello to everyone. So guys, how is the audio visual? How is the audio visual? Guys, how is the audio visual? Am I audible? Am I visible? Is the screen visible? Guys, quickly, before we start the session, I want your thumbs up in the chat box. Okay, it's already started, but I think it is started. It is live at my end. So is it started at your end? How is the audio visual? Please quickly write in the chat box. All right, so guys, those who are new here, this is Dr. Kashish Grover, your PSM faculty at DAMS. And guys, I want to tell you that the wrap up for Block 4, right? Wrap up for Block 4. This is important because most high yield chapters from PSM, demography, MCH, NCD, programs and nutrition. All of these high yield chapters we are going to cover. Like before we have covered, first of all, my focus will be on the questions which we have discussed in the quiz. The wrong question analysis, we'll be doing wrong question analysis. Then keywords, some images and rapid fire. Without wasting time, let's get started. In a district, guys, total births are given here. Total births are given here, right? So suppose if they have written, right? So here they have written total live births, and maternal deaths are given. So guys, what is maternal mortality ratio? Maternal mortality ratio is total maternal death divided by live birth. Total maternal death divided by live birth. Now bachcho, in this question I want to tell you that total live birth they have given and maternal deaths. Maternal deaths, what is a maternal death? Guys, this is a point to focus on. What is maternal death? Maternal death is death of a pregnant woman during pregnancy or during childbirth or after childbirth up to 42 days. Up to 42 days. But accidents are not included. But accidents, any accidental death during pregnancy or in postpartum period is not considered as maternal death. Is not considered as maternal death. Guys, many of you are asking about probe video. Someone is asking other doubt. While we are discussing complete, I want your complete focus here, right? In just 25-30 minutes, I want your extreme focus here. All the high yielding keywords we are going to discuss. Your queries I will take at the end, right? Now macho, live birth. Okay, so death because of hemorrhage, yes, it is included. Obstructed, yes, it is included. Hypertension, yes, it is included. So how many maternal deaths here? 20 divided by, and what is the live birth? 12500, right? 12500. Accidental deaths are not considered in accidental deaths are not considered. Okay, quickly write in the chat box, what about abortion? Any death of a pregnant woman during abortion or because of abortion, will you consider as maternal mortality? Yes, we will consider. Yes, we will consider it as maternal mortality. Any death because of ectopic pregnancy? Yes, ectopic pregnancy. Only exception is accidental. Only exception is accidental. Right? Only exception is accidental. Now, a city reported following data. Total live birth is given 8,000. Neonatal deaths 15. Post neonatal death 20. Calculate IMR. Guys, what is neonatal death? It is 0 to 28 days. What is post neonatal death? 28 days to 1 year. 28 days to 1 year. So when you calculate, you will get total infant deaths divided by total live birth. Total infant death divided by total live birth. So this is regarding infant mortality. Guys, MCH indicators are very important. Infant mortality rate, maternal mortality rate, and neonatal mortality rate, very important, right? Now guys, according to SDG, this is the mnemonic, not a mnemonic, just numbers 701225. If you repeat number with me 70 12 25 2 or 3 times, you will definitely learn it. I have seen those students who have attended my face-to-face class, I have seen them learning in just few minutes, right? So 70 here is MMR, 12 here is neonatal mortality rate, and 25 is under 5 mortality rate. According to SDG, by 2030 we have decreased MMR up to 70 per 1 lakh, and neonatal mortality up to 12, and under 5 mortality up to 25. Yes, so this is a magical number 701225. Just guys, it is easy. We learn a 10-digit phone number. Why? Because of the rhyming in our this is important, right? 701225. Now good, but according to minimum antenatal visits for a pregnant woman according to WHO, guys, this is important. Now if I talk about antenatal care visit, we have minimum visit and ideal visit. Ideal visit is around 13 to 14 visit. Minimum visit according to Government of India, it is 4. According to WHO, it is 8. Earlier WHO used to say 4, but now WHO says 8. Very good beta, very good. It is 8. Hospital records. Now bacho, see here they have not mentioned total live birth. Here they have mentioned total births and stillbirths. What is the stillbirth rate, guys? Stillbirth rate formula is number of stillbirth divided by stillbirth plus live birth multiplied by 1000. How many stillbirth here? 25. And here they have already mentioned total birth, right? So it is 1500. Without any doubt, it is 1500 multiplied by 1000. You will solve and you will get the answer. It is very easy. Okay, I have one question. What is perinatal mortality rate? Guys, quickly, can you write the formula for perinatal mortality rate in the chat box? Everyone, I request you to please write the formula for perinatal mortality rate in the chat box. I am waiting. The perinatal mortality rate. Guys, perinatal mortality rate. Anyone who can write perinatal mortality rate formula in the chat box? Perinatal mortality rate says stillbirth rate plus early neonatal mortality rate divided by stillbirth rate plus live birth. What is early neonatal mortality rate? It is up to 7 days, 0 to 7 days. Guys, 0 to 7 days is early neonatal. Very good, bache, very good, very good. Good beta, very good. Very good everyone, very good. You have given every one of you correct answer, right? Now moving to next question. Guys, anemia. It is very simple. What is anemia in pregnancy? HB less than 11, anemia in pregnancy. What is severe? HB less than 7 is HB less than 7 is severe. Guys, what is mild? What is moderate? Many students were asking this doubt. This is very important. We have taught you in OBGY as well as in PSM. I have covered this doubt in PSM. This is important. But mild is 10 to 10.9 is mild, and 7 to 9.9, roughly 7.9 to 9 is good beta. Now, so in this question, find the keywords rural area, MP, and she is the mother. She has been registered for antenatal care and baby girl at the facility. After delivery, she is entitled for how much? Guys, this is important. JSY incentive is important, very, very important, and this is NEET-PG recent question, so you can't miss it. 2 years back this was asked. This is very important. This is very important. Now, bachcho, now, if I talk about JSY incentive, the incentive is given to Asha and mother. The incentive is given to Asha and mother. If Asha is from rural area, she gets 600. If she is from urban area, she gets 400. But mother, it depends. If mother is from rural, urban. If the rural area which the mother is belonging to belongs to a low performing state, if rural area of low performing state, it is 1400. If it is high performing, half of low performing state. If it is a urban area, if it is urban area of low performing, high performing, urban area of low performing, 1000. Half of this is around 500, but here we are giving 600, right? This is JSY incentive. This is very, very important. This is very, very important. Guys, I am not able to see everyone's chat. You keep answering, you keep interacting. I'm not able to see everyone's chat because of the maximum participation here, huge participation here. I might not be able to see your chat. I might miss your chat. Right? So if I miss your chat, please ask again, right? If I miss your chat, if I don't see your doubt, if I don't see your message, don't worry, please ask again. Now, guys, Lakshya. The Lakshya is for labor room quality. Labor room quality. So they are asking you the primary goal for Lakshya to reduce the number of cesarean, to increase the institution, to improve quality care of labor room. To improve quality care of labor room. Now, Priya delivered her second child and she belongs to a low income. She is BPL. Guys, under Pradhan Mantri Matru Vandana Yojana. This is important. Listen. Under Pradhan Mantri Matru Vandana Yojana, on first child, we give 5,000 in 2 installment. First installment 3,000, second installment 2,000. In case of second child, she gets only when, in case of second child, she gets 6,000 only if the child is girl. If the child is girl. Right? So in this case, Priya is not eligible for the money because it is her second male child. Right? If it is like female child, then we would have given her 6,000 in single installment. Very good, bache Gaurav. Single installment. Very good, beta Umesh. Second boys are not benefited. Good beta Ashish, Khushi. Very good beta. Ruma, Sahil, good. Now, WHO steps approach. Guys, this is important. This has been asked. I have not asked you directly what is WHO steps approach. I have given you a scenario where I am asking you which of the following is a WHO step 2. Guys, in step 1, we just take demographic history. We take their behavioral history. We ask them how much fruit you consume, are you smoker, are you alcoholic, you have any family history, your age, and all of these factors. Then we go to second step. In this step, we ask them to take their measurements. We take their measurements, right? Weight, we take their BMI. So do you have family history? No, this is not correct. We need to measure your weight and calculate BMI would be the best answer for WHO step 2. Guys, quickly, what is step 3? Anyone who can tell me about step 3? This is step 1. This is step 2. Anyone who can write in the chat box about step 3, what we do in step 3? I have told you step 1, I have told you step 2. Can anyone write in the chat box about the step 3? As a public health expert, okay, this is important and I love this topic. I love this topic. So this is rule of half. This is rule of half. Let me draw it and then we'll go ahead. Guys, first of all, rule of half is only and only for hypertension. It is only for hypertension, not all NCD. Not all NCD. 50% population is not suffering from cancer. Right? It is not applicable for all NCD. It is only applicable for hypertension. Right? It is only applicable for hypertension. Guys, this is the total population. Out of total population, 50% they have hypertension. Those who have hypertension, 50% they know they have hypertension. Right? And those who know they have hypertension, 50% are taking treatment. So, she finds that 600 patients with hypertension are aware of their condition. So 600 is diagnosed. How many patients with hypertension in this area achieve blood pressure control? And 50% are able to control blood pressure. 50% are able to control blood pressure. So guys, this is 600, this is 300. So if 600 are diagnosed, 300 are taking treatment according to the rule of half, and only 150 is able to control blood pressure. Only 150 is able to control blood pressure. Rule of half is a recent previous year question. Guys, NCD, very important, rule of half. Your WHO steps approach, tracking of blood pressure. Past 2-3 years, they have been asked continuously in NEET-PG and in FMG exam. Right? Now, good bit of good. Okay, so guys, keywords in nutrition chapter. In nutrition chapter, only keywords are going to help you. Dermatitis, glossitis, maize. Definitely, this is niacin deficiency, which causes pellagra. Guys, paper is incomplete without neurolithiarism. It is incomplete without pellagra. Aana hi aana hai. Last year, NEET-PG 23, 2 questions from one topic, neurolithiarism. Right? Now, so pellagra, niacin deficiency. Let us quickly revise 4D. 4D of pellagra. Diarrhea, dermatitis, dementia, death. Right? Apart from these 4D, we see glossitis, stomatitis, and this is seen in maize eaters. Okay, Dr. Abhi Rami is asking about zinc deficiency. But I'll talk about zinc deficiency and I'll tell you the difference. Please wait for a minute. I'll definitely tell you. Don't worry. Guys, okay, this beautiful question, a beautiful history, NEET-PG 23 PYQ, a very important topic. Guys, why this important? Why this topic is important? Psychiatry people, they have this topic in their discussion. Biochem people, they have this in medicine, they have this topic. PSM, same topic, right? Anyone? Guys, this is vernix encephalopathy. Vernix encephalopathy. This is seen in alcoholics, and there is one place in India where there is no deficiency of this thing. So the mnemonic here is Goa. G, global confusion of ophthalmoplegia, ataxia. See, confusion, ophthalmoplegia, ataxia, chronic alcoholism. These keywords are enough to tell you that this is vernix encephalopathy. Okay, yes, this is vitamin B1 thiamine deficiency. So the correct answer here is B. Guys, bilateral pitting edema, heart failure, mustard oil. 3 keywords for a beautiful diagnosis. Right? Yes, very good bache. Asmita, very good. Maize is basically, maize may trip. Guys, okay, one student was asking why maize eating is causing niacin deficiency. Guys, maize में ना tryptophan बहुत होता. High tryptophan in maize. I'm sorry. Tongue slip. Maize is deficient in tryptophan. Tryptophan is needed to make niacin. But maize is high in other amino acid. It is high in other amino acid. बहुत ज़्यादा high होता है ये leucine में. This leucine inhibits conversion of whatever tryptophan you are getting from other dietary sources. Guys, listen. मेज में खुद का tryptophan नहीं है, कुछ और भी खा रहे हो आप, उसका tryptophan नियासिन में कन्वर्ट होना चाह रहा है, पर मेज का हाई ल्यूसिन इसको इनहिबिट कर देगा. That is why. Okay, coming back to the question. Epidemic dropsy. Guys, mnemonic. Anyone remembers my mnemonic here? Anyone? If anyone can write in the chat box my mnemonic. A drop of mustard oil. Epidemic dropsy. A drop of mustard oil. Epidemic dropsy is seen because of the adulteration of mustard oil. होगा क्या? Drop मतलब fluid. Mnemonic याद करते हैं. Pedal edema because of fluid. आंखों में अगर fluid ज़्यादा होगा, glaucoma. हार्ट में ज़्यादा होगा, congestive heart failure. GI में ज़्यादा होगा, diarrhea. These are the symptoms of epidemic dropsy. This happens. Good beta, good bachcho, very good. Now, guys, this is important. Moderately active. For moderately active, guys, listen. Sedentary, moderate, heavy worker. Male, female. Guys, always remember a rule. Boys, you listen. Always remember one rule, right? Female first. So, female needs 1600 kilocalories. Now add 500 and 1600, 2100 kilocalorie. Add 600, 2700 kilocalorie. Whatever a moderate female needs, a sedentary man needs the same. Add 2700. Now add here 500 add here 600, add here 600, add here 700. So 3700 is for the heavy workers. Here the best answer is 2700 kilocalorie. Good, Dr. Supreet. Female sedentary is the lowest. Very good, beta. 21. Good, beta. Good, Jyoti. Good, Umesh. Good, Adesh. Good, bacho. Everyone, good. Now, guys, this is important. I have discussed in my every face-to-face class and as well as in my back to basic, DAMS back to basic videos. Now, who is responsible for the RBSK? Guys, listen. In RBSK, we have to screening. कौन से ग्रुप का? 0 to 18 year. What you are going to screen? 4Ds. Quickly write in the chat box about the 4Ds of RBSK. They are not same. They are not same as of the 4Ds of Pellegram. So, if the kid is 0 to 6 weeks, 6 week to 6 month, 6 months to I'm sorry 6 weeks to 6 year, 6 year to 18 year. If a child, the age is 6 to 18, you are going to find that child in school. 6 week to 6 year, you might find that child at Anganwadi center. And 0 to 6 weeks, either you will find at home, or if the child is newborn, up to first, second, 3-4 days, depending upon the mode of delivery, the child is in hospital. So if the child is in hospital, who is responsible for RBSK? Disease, deficiency, defect, delay. Very good, bacho. Very good. Superb. Now, if child is at hospital, who is responsible for? Staff is responsible. If the child is at home, who is responsible? Asha. But here, who is responsible? In these two scenarios, the only person who is responsible is mobile health team. Mobile health team. Mobile health team. Right? Mobile health team. Now, guys, this question caused confusion to many. Let me explain the concept. Guys, there is one enzyme in the raw milk. That enzyme is phosphatase. When you boil the milk, when you pasteurize the milk, that is destroyed. So technically, phosphatase test is positive in raw milk. Phosphatase test is negative in pasteurized milk. Right? So I have here the slides to show you. Here the phosphatase is positive, so this is a raw milk. Here phosphatase is negative, so this is the pasteurized milk. This is the pasteurized milk. Right? Can you see the yellow color here? So this is positive. If it is positive, if phosphatase is positive, it is raw milk. Right? This is very important point in public health. Right? This is very important point in public health. Now, so the milk, if it is negative, so the milk has been pasteurized. Okay, those who are asking about UPSC results, guys, we can discuss the result after 10 minutes, right? Let us focus right now. Only 10 minutes are left, and we can discuss after that. We will discuss result, right? Don't worry. Guys, history, keyword, yes, please find the keyword. Raw egg, brittle hair. Raw egg में होता है avidin. This avidin causes biotin deficiency. This biotin deficiency causes brittle hair, right? So biotin deficiency due to raw egg. Okay, foamy patches on conjunctiva, guys. This is easy. Nothing is easier than this. Vitamin A deficiency, bite out spot, foamy patches on conjunctiva. Okay, death rate has declined, birth rate is unchanged. So stage 1 both high, stage 2 death rate is same, birth rate decreases, stage 3 both decreases, stage 3 both decreases, stage 4 both low. So here they are talking about death rate has declined but birth rate is unchanged. Death rate decreased, birth rate unchanged. This is stage 2. This is stage 2 of demographic cycle. Guys, demographic process. First of all, marriage, then fertility, marriage, fertility, social mobility, migration, death. These 5 things, they affect the demography, right? So guys, I teach it like this, that first someone is getting married, then childbirth, babies, fertility, then they have just moved to the other socioeconomic class, social mobility, then they are not happy with their country, they want to move to other place, migration, and finally death. You can learn it like this. You can learn it like this story, and it is very easy. No environmental change is here. Guys, net reproduction rate. Many students ask me about net reproduction rate. Okay, what is total fertility rate? What is gross reproduction rate? What is net reproduction rate? Guys, total fertility rate is number of children born to a woman, number of children born to a woman, number of total children born to a woman. It is total fertility rate. What is gross? What is, this is total fertility rate, and in gross reproduction rate, we have number of girls born to a woman. So in TFR, boys, girls, both. In gross GRR, only number of girls born to a woman. In NRR, number of girls born to a newborn girl, right? Born to a newborn girl. So the total number of girls born to a newborn would have in her lifetime, considering current mortality. Another MCQ, which considers only mortality, which considers mortality also. NRR considers mortality also. So guys, 940 females for 100 males. So we can say the sex ratio is less than 1000 here. When the sex ratio is less than 1000, the district has higher number of males than females. Ideal sex ratio, no. When 100 female and 100 males are there, this is known as ideal sex ratio. Equal number of males and females, no. The district has higher number of, no. So here the A is correct because it has 940 females and 1000 males, right? 940 females and 1000 males. Yogesh is asking about, please tell GFR also. Yogesh, what is birth rate? Number of live birth divided by the mid-year population. This is birth rate. But every person of the population is not responsible for the childbirth. So in GFR, the numerator is number of live birth divided by women in reproductive age. Yes, this is GFR. This is GFR. Now, guys, this is important. Dampa injection. Guys, if I have given DMPA here, then I will repeat after 3 months. Right? I will repeat the patient. I will ask the patient to come after 3 months. But exactly if she is not able to come in the duration, then till what time we can give? Now we can extend the day up to 1 month and 15 days. Up to 1 month and 15 days. Yes, Asmita, good. Live birth divided by reproductive age female. Good beta, very good. So administer the next dampa on 10th May. Right? Now in this example, the female came on 15th Feb. Now she is due. Okay, so first dose was given. Okay, I think I have made the wrong example here. I'm sorry. Okay, so this is the due date. So 15 days prior to the date to 15 days to 1 month, or you can say 2 weeks before the scheduled date and after 4 weeks after the scheduled date. This is the time where she can take her next dose, and she is just on the time and we can give. Broad base in population pyramid. Guys, this is population pyramid. Something like this. This is population pyramid. Something like this, right? So here we have age like 0 to 4 years, then 5 to 9 years, 10 years, something like that. Broad base means more birth rate. Broad base means more birth rate. What about broad belly? Guys, what about broad belly? What about broad belly? Yes. What about broad belly? Broad belly means the middle portion is broad. That means more working population. Very good, Dr. Arohi. More working population. Broad belly means more working population. Quickly. Guys, this question, many of you got confused. What is dependency ratio? Less than 15 year plus more than 65 year divided by 15 to 65 year. 15 to 65 year. This is dependency ratio. Now what is young dependency ratio? Less than 15 year divided by 15 to 65 year. What is old dependency ratio? More than 65 year divided by 15 to 65 year. Right? Now, in this question, how many children? 25,000. And what about the working age group? 75,000. They're asking about young dependency ratio. They're asking about young dependency ratio. Good beta. Alright, so we are done with the question discussion. And we are done with the question discussion. Is it 25,000? Yes, 25,000. We are done with the question discussion. Now the images related to this topic. Guys, this image very, very important. What is this? Everyone, which image is this? Cazal's necklace. Cazal's necklace seen in niacin deficiency. Niacin deficiency. Guys, this is zinc deficiency. This is zinc deficiency. In zinc deficiency, there is diarrhea, there is dermatitis. In niacin deficiency, there is diarrhea, there is dermatitis. The only difference is that here it is periorificial, around the face, around the mouth and around the anal region. So this is zinc deficiency. One student was asking me about the rash for zinc deficiency. Yes, beta, acrodermatitis enteropathica. Now, guys, centroman is important. This is non-steroidal OCP. This is non-steroidal pill, not OCP. OCP is used for the hormonal ones. This is non-steroidal pill. है क्या इसमें? Or meloxifene. What is there? Or meloxifene. Right? So 2 times a week This is given for first 3 months. After that only once a week this is given. Good bache. Arohi 30. Good Ruma. Sent Kroman is there. Vaishnavi. Yes, this is Chaya. And Baishali, Prateek. Good beta. Yogesh. Good. Good Gaurav. Very good bache. Now beta, I want to tell you that under Government of India, 2 copper T devices are given. Earlier it was only one copper T 380A. So this is copper T 380A and this is copper T 375. This is for 10 years and this is for 5 years. If the patient comes to you, the beneficiary wants to have only 5 years, then up to 5 years, then you go for 375. This is a U-shaped, whereas copper T 380A is a T-shaped, and this is for 10 year. Long duration, copper T 380A. Short duration, under Government of India, 375. Good beta, very good. Now this is scurvy, and this question was asked in NEET-PG 23. This is because of vitamin C deficiency, and this is fluorosis. This image is fluorosis. First, best seen, the fluorosis is best seen as a mottling on the central incisor, upper central incisor, as you can see here. Good beta, very good. Now, coming to the rapid fire. Now, can I see some fire in the chat box? Are you ready for the rapid fire? The one-liner, high-yielding points related to today's discussion. Right? Are you ready? Now bacho, toxin in neuroletharism. Can I see some fire in the chat box? Yes. Can I see some fire in? Alright, so this is BOA. Vitamin which can prevent neuroletharism. Vitamin C. Epidemic dropsy is caused by adulteration of mustard oil with argemone oil. Toxin in epidemic dropsy. Bacho, toxin in epidemic dropsy. Anyone? Toxin in epidemic dropsy, sanguinurine. Zinc deficiency, mnemonic is DAD. Diarrhea. Alopecia. Dermatitis. Vernix encephalopathy is seen in alcoholics, and the mnemonic here is Goa. And one last thing, thiamine deficiency. Niacin deficiency, 4 Ds: diarrhea, dementia, dermatitis, death. Surveillance indicator for iodine deficiency. Okay, who will tell me? The second last. Who will write in the chat box? First? Let me check. Who will write in the chat box first for the answer of second last question? Surveillance indicator for urine for iodine deficiency. No, bache, no. Good. So it is Dr. Sahil. Very good, Dr. Sahil. Urinary iodine excretion. Okay, I will tell you I will tell you. Okay, I know many of you must have crammed this, but why? See, we are doing surveillance whether people are consuming iodine related products like iodized salt or not. The best way to check this in the community is to check their urine. If urine is positive for iodine, if there are iodine content in the urine, right? So this is like how the things go. Urine iodine excretion. No stationary. Very good, beta. So let me check who has answered first. Oh, all right. Dr. Swagata Sinha answered first. It is stage 4. It is stage 4. Okay. Health programs quickly in next 60 seconds. In next 60 seconds, we are quickly going to revise all MCH health programs. Lakshya, yes guys, Lakshya, last slide. This is last slide, and I know it's a long session today because of all the high yielding topics related to block 4. Lakshya, bacho, Lakshya, quickly, Lakshya. Very good. So it is Dr. Gaurav Garg, Dr. Safia, Asmita. Very good, beta. They have answered. The first Lakshya is labor room quality. And what about JSY? JS? Right? Okay. Janani Suraksha Yojana. Right? JSSK. JSY. Here we give free everything. Good beta. Good. Free delivery, free diet, free. And here we give cash incentive. Here ANC visit on 9th of every month. Pradhan Mantri Matru Vandana Yojana, cash incentive. Here ministries MOHFW, here ministries Women and Child Development, we have already discussed. RBSK is screening of 4Ds. RKSK, Rashtriya Kishore. So this is for adolescents, this program is for adolescents. NSSK, this is for training. In NSSK, training is given for the basic neonatal care. Mission Indradhanush is for 12 vaccine preventable diseases. Abhiyan Indradhanush is for change of bedsheet as per WIBGUR. As per WIBGUR. With this, we end our discussion. Thank you so much for your patience, and be ready. From tomorrow, we will be entering in block 5. And guys, block 5, I have kept all the small chapters, biomedical waste. In block 5, small chapters, sociology, occupational disaster. So block 5 is about all the small chapters. And block 6 is about the biostats, epidemiology and screening, all the topics which are painful for medical students. So that's why I have kept that in the last, so that we can have a revision before exam to have a maximum benefit, right? Okay, so now one message which is coming to me again and again in my DM, in my right, and earlier in the chat also, we have seen some messages related to UPSC. Guys, those who have cleared the UPSC, I congratulate you. Those who could not make up to their expectations, guys, UPSC exam and NEET-PG exam, don't think they are both same. I have seen many questions which were there in UPSC. So this is my reason number 1 for you to not worry about your UPSC result. NEET-PG pattern and UPSC pattern, the questions, the weirdness of question, whatever you can say, This is my reason number one. I would say trust your preparation, trust yourself, trust Almighty. Point number two, guys, the result is there. Exam happened already. If you feel something was not up to your expectation, I request you to not waste the time which is there in your hand by thinking what is in the past. Focus. Your exam is there. Just forget it. Just forget it. You cannot compare apple with oranges. You cannot compare that exam preparation with this exam preparation, right? I agree, syllabus is same, right? Yes, gloves, be it blood stained or not, they go in red bin, right? So this is my request to all of you. If you have cleared, if you have not cleared, forget UPSC. This is simple. If you have cleared, you are not going to leave NEET-PG exam and join it. You have your interview, you have other plans. If you have not cleared, guys, for both NEET-PG is there. Focus on NEET-PG, that's it, right? I know it is easy to say, then to be, to be the one who is going through that phase. I know it is easy, but only one advice for all of you. Just don't think about UPSC result. Don't open it. Even don't open it. If you are not opened it, don't open. Open it after 11th August. Right? All right. Okay, nice t-shirt. Thank you. Okay, can I end the session? Now we end the session, right? Oh, now they have written 40% is because of type 2 and they have written 99% VDPV. I think 97% or 99% is because of type 2. So they have written 40%, they have not written 100%, 90%, right? See, type 2 is the main. Guys, listen, why type 2? Why we talk about type 2? Because type 2 is not in the world from 1999. 1999 was the last year when we had a wild type 2 case in the world. Since then, no type 2. Now, it doesn't mean type 2 will not cause VAP. It will cause VAP. But majority of VAP cases still will be type 3. Right? Okay, thank you. All right, so I think here we should end the session and let's get back to your schedule. PSM is done for the day. Let's get back to your schedule. Tomorrow we'll have a Telegram quiz, right? Good night, everyone. Take care. God bless you. If any doubt, you can ask in the Telegram, right?